The skills and knowledge a well-trained lifeguard brings to their pool ensures safety for all. A valued and demanding labor, it is among the few professions engaged with the responsibility of guarding lives. Seems daunting at first, but please be rest assured with this knowledge. A lifeguard with an elite understanding of their responsibility will prevail. Furthermore, a proactive lifeguard keen on identifying risks will prevent many accidents from occurring. Starting with the basics of a lifeguard's uniform and equipment, to next covering scanning and the 1020. How to identify at-risk swimmers and how to assist. Followed up by the different rescue techniques, and assessing the patron's condition. Next skill will be how to administer rescue breathing on a non-responsive patron and how to perform care on a responsive choking patron. Cardiopulmonary resuscitation will begin if the patron has lost their pulse and breathing. How lifeguards will perform depends on staff and the age of patrons. Lastly, a lifeguard will comprehend the nuances of assisting a patron suspected of a spinal injury and how to use the backboard while maintaining SMR. If at any moment you feel the need to re-review skills, please feel free to do so. There's never any shame in lifeguards striving to stay up to date on their skills and knowledge. After all, a lifeguard with an elite understanding of their skills ensures safety for all in their pool. Module 1. Uniform and Equipment. Lifeguard swimsuit. Hip pack and Seal Easy. PPE personal protective equipment. Whistle. Sunglasses. Water container. Sunscreen. Gloves personal protective equipment. Scanning your water. Scanning should not feel robotic. Effective scanning is a combination of eye movement, head movement, body position, alertness, and engagement. However, scanning is more than just movements. Make sure to cover all corners and to do a bottom scan right below your feet. If you see something that looks out of the ordinary, target anyone whose face is under the water in any position or anything unrecognizable on the bottom on the pool floor. A rotation should be more than moving between stations. It should be proactive, meaning that you scan your way to the station, and when you leave the station. Scan the water as you walk toward the zone so that you can get a feel for the activity level and begin to prepare yourself mentally for your scanning responsibility. When in doubt, check it out. If you don't know, go. Emergency Action Plan. EAP. EAP is a written document detailing who does what and when in the event of an emergency. Every pool has a handbook detailing the EAP. Lifeguards and managers will practice such roles of an EAP to have an understanding of how to act and what equipment to use if such a situation were to occur. A pool should be covered by another lifeguard or cleared if the situation demands all hands on deck. 911 should be called by the nearest available person, alerting EMS to the situation. Communication is the most essential part of an EAP, and the whistle is a primary tool a lifeguard uses in this situation. The types of whistle blasts. 1 long whistle. This signals that the lifeguard is leaving their zone of protection to assist a patron. 2 long whistles. The lifeguard has come across an unresponsive patron or one suspected of a spinal injury. This is followed by the EAP, along with the lifeguard raising their fist in the air to identify themselves to their corresponders. 1 short whistle. This is to grab the attention of any patron. 2 short whistles. This is to grab the attention of another lifeguard. Equipment. Guard tube. The guard tube is used to hold patrons of any size above the water surface to allow the lifeguard to assess their condition. Backboard. The backboard is used to extract from the pool either a patron who has gone unconscious or one who is suspected of a spinal injury. Automated External Defibrillator, AED. A powered device that monitors heart rate and administers shock to the patron using attached pads. There is a difference between adult pads and pediatric pads. Rescue types. Tube assist. Patron is near enough to the pool edge, allowing the tube to reach them. Grabbing the tube should keep the patron above the water. Front rescue. The patron is facing the lifeguard. Upon contact, the lifeguard reaches to the patron with the tube submerged under the water's surface, pushing the tube into the front of the patron, forcing it into their grasp. Continue to push the patron to the edge or the exit of the pool. Rear rescue. Patron is facing away from the lifeguard. Upon lifeguard making contact, they place the tube between themselves and the patron. The lifeguard then wraps their arms around the waist of the patron while keeping their head back, securing them to the tube above the surface of the water. From here, check the airway. Under the surface. Patron is within arm's reach below the water. Upon the lifeguard making contact, they place the tube between themselves and the patron using one hand. Be sure to move them so the tube rests at the small of their back, helping them float and to open the airway naturally. Submerged rescue. Patron is below the surface of the water, near or at the floor of the pool. Once the lifeguard is above the patron, they can then submerge themselves under the water and do one of the following. A. The leg grab. Diving just beneath the surface, the lifeguard wraps their legs around the patron's waist, pulling them up, then using their arms to pull the patron to the surface, securing them on the tube. Deep dive. Using the pencil submerge technique, the lifeguard then descends to the floor of the pool. They then wrap either their legs or their arms around the patron, and once secured, the lifeguard will pull on the tube strap, allowing the tube to pull both of them to the surface. Upon surfacing, place the tube under the small of the back of the patron. Check the airway and deliver breaths. If the patron is putting your safety at risk, be sure to prioritize your safety. Push them away or call for the help of a secondary responder. Spinal injury. A spinal injury can create permanent paralysis and change a person's life in a matter of seconds. Because you have no way to diagnose the extent of damage, the objective when you suspect a spinal injury is to protect the spine from further injury until EMS arrives. You will do this by having the person minimize spinal motion on their own or manually helping them to do so. The first responding lifeguard who identifies the injury will activate EAP. They will then enter the pool in a gentle manner to not disturb the water surface by a great amount. Upon making contact with the patron, the lifeguard will activate spinal motion restriction. This is done by grabbing the triceps of the patron and pressing both arms to the head. This technique uses their anatomy to secure the spinal area, preventing further injury. Once secured and smeared, the secondary responder approaches with the backboard. The secondary responder levels the backboard along the length of the patron. Using both arms, the secondary responder submerges the board under the patron, allowing said patron to float on the water surface on top of the board. Followed after, the secondary lifeguard starts with the chest strap, securing the patron, continuing down to the remaining straps that go to the shins. Once the torso of the patron is secure, the secondary lifeguard grabs the cheekbones with their thumb and fingers, while their arm is pressed along the sternum of the patron. This will help stabilize the spine. The initial first responding lifeguard, now free of smur, then uses the head blocks to secure the patron's head to the board, along with strapping the head straps. From here, being as gentle as can be, both lifeguards extract the bound patron out of the pool and then proceed to pull the patron 6 feet away from the edge of the water, and then wait for EMS. Opening the airway and rescue breathing. Rescue breaths are artificial breaths given to someone who is not breathing normally. They are given by blowing air into the mouth to inflate the lungs. The airway is the only passageway between the mouth and lungs. It must be open so that air can freely enter and leave the lungs. Someone who is unresponsive can lose muscle tone. If flat, on their back, the base of the tongue can relax and block the airway. The tongue is attached to the lower jaw. Lifting and thrusting the jaw forward while keeping the mouth open pulls the tongue away from the back of the throat and opens the airway. If you are alone, the head tilt, chin lift from the sides will usually be the best, so you don't have to interrupt care to move position for compressions. If you are with other rescuers, a triple airway maneuver from a position behind the head is a convenient and effective approach, especially if you will be using a bag valve mask or AED. Establishing an airway for an unresponsive person is a higher priority than protecting a suspected injury to the spine. Use the triple airway maneuver, jaw thrust, when necessary to open the airway or give rescue breaths. If you open your hands from the head, the airway will close again. You will need to open the airway each time you give rescue breaths. Use your thumb to open the lips if they close. CPR. Cardiopulmonary resuscitation consists of external compressions of the heart to circulate blood. Cardio, combined with rescue breaths to supply oxygen to the lungs. Pulmonary. CPR begins with a quick assessment of the person's age category, breathing, and pulse to determine the next steps to take. Assessment. CPR procedures differ slightly for adults, children, and infants. Although no single factor can distinguish an infant from a child and a child from an adult, to simplify training, CPR guidelines use these age ranges. Infant, less than 1 year old or able to be held and supported with one arm. Child, 1 year old to about 8 years old. Adult, anyone 8 years and above, usually going through or experiencing the early stages of puberty and beyond. During an emergency, the actual age may not be known, so a decision on whether to use child or adult methods should be based on body size. The next step in CPR is to quickly check if a person is breathing normally and checking for a pulse to see if the heart is beating. Sometimes a person who is unresponsive will make noises that may be mistaken for attempts to breathe. This is known as agonal breathing and is not normal breathing. To deliver compressions, make sure that you bring your knees to the side of your patient. Make sure that one knee is nearby their hip and the other knee is just below their armpit. Leaning your upper body over theirs, look for the patient's sternum. This is going to be in between the middle of the nipple line, following the center of the chest. You're going to want to place both of your hands together, clasping them, with your elbows locked, upper body still leaning heavily over the patient, with your hands now pressed on the patient's sternum, and this is when you will begin giving your chest compressions. For the adult method, you will go up to 30 compressions, followed by 2 breaths. If you are a single rescuer, and you have a child or an infant on you, you will deliver 2 breaths for 30 compressions, only if you are alone. Now, when you have another lifeguard with you, and you have a patient who is an infant or a child, the ratio of compressions gets cut down to 15, and there is still delivering of 2 breaths after every set of compressions. To aid in CPR, there is a tool at your disposal known as the AED, the Automated External Defibrillator. This is a device that uses pads to connect to the patient's chest in order to analyze their heart rate, breathing, and heart rhythm. This device delivers a shock that temporarily stops any electrical signals going to the heart. From then, the lifeguard delivering the compressions will be able to set a perfect rhythm for the heart to allow it to deliver blood to the rest of the patient. If you begin to notice your patron awakening, you're going to do the following. Putting them into recovery position. This involves putting one of their arms lined up along underneath their head, as well as the other of their legs, kicking it up into a kickstand, and then proceeding to roll them onto their sides in a way that supports the head, but also allows any fluids that will come out of the mouth to drain naturally. Again, this is called recovery position.